All right. Now, the way that the book is set up to make things a lot easier for you is, in general, we're going to talk about the DNA viruses first, then the positive stranded RNA viruses, then the negative stranded RNA viruses. But before we really get into that, we're going to take all viruses from all of those different groups and compare them and talk about viral hepatitis. So we're going to talk about that first. So we'll be talking about some RNA viruses, some DNA viruses, so that you'll have a very good idea as far as differentiating between the different types of viral hepatitis. Then we'll start with some of the DNA viruses specifically. Okay, for viral hepatitis, clearly, symptoms that you're going to be looking at are fever, malaise, headache, anorexia, all of the symptoms that you're familiar with for hepatitis. And the different viruses we're going to be referring to and talking about are hepatitis, the alphabet soup for hepatitis, A, B, C, D, and E. Okay? Now, I just want you to notice first that hepatitis A and hepatitis E are both fecal-oral transmitted, and they're both non-enveloped. So they're both naked viruses. Okay? Whereas hepatitis B, C, and D have to be spread pretty much by serum, sexual contact, for example, and those are all enveloped viruses. All right. Now, hepatitis A is the virus that even like a whisper of it will shut down an entire restaurant, sometimes even chains of restaurants. Okay? This is the one that you get from some type of fecal contamination that occurs at the restaurant. There's usually a cook or somebody at the restaurant that's Hep A positive, and they're transmitting it in their feces, and they can transmit that onto you. Okay? And we'll talk a little bit more about the disease in just a minute. Hepatitis E is very similar to hepatitis A, but there's one difference. It is extremely, extremely virulent during pregnancy. So pregnant patients that get hepatitis E have a very high mortality rate when they get Hep E. So that's going to be one of the differences. Now, for Hep B, C, and D, hepatitis B, we're going to be spending a good bit of time on, and I'm going to help you in learning all of the different markers that are there and how to diagnose different stages of hepatitis B. Hepatitis C is sometimes called post-transfusion hepatitis or non-A, non-B hepatitis. The reason why that is because in the blood supply that we use, we always knew to test for Hep A and Hep B, and we were screening the blood for those, getting rid of the blood that was positive for Hep A and Hep B, but people are still coming down with hepatitis post-transfusion. And they finally determined that that was this virus that we're calling now hepatitis C. Hepatitis D is not really, let's say, a true virus. It's a defective virus. And hepatitis D virus can only cause infection if it somehow manages to get into the same cell with hepatitis B virus. So only can it really cause infections during a co-infection with hepatitis B. And I'll talk about what happens if that happens in the next slide here. Okay, so I want to move on again, look at some of the other features of the different hepatitis viruses. First, transmission, which we already mentioned. Hepatitis A and E are fecal-oral. B, C, and D are all parenteral and sexually transmitted. Now, we go down to the disease. For hepatitis A, this is considered a mild and acute infection, although you may not feel like it's mild when you get it. And this is the one that typically will shut down restaurants. Now, there was actually a restaurant chain probably a couple hours south of where I live, and there was this whole outbreak of hepatitis A at that restaurant, and it happened from contaminated green onions that they had imported in from another country that were actually contaminated with the virus. In that one restaurant, over 400 people developed hepatitis A, and even though you see there that it's usually mild and acute, there were actually about 3 or 4 deaths in that particular outbreak because the people were immune suppressed. There was actually a transplant patient that acquired hepatitis A. Okay. What happened after that was the entire chain of restaurants disappeared off the planet. So not only can it shut down the restaurant that it comes from, if it's a chain, it'll often shut down the entire chain. So very, very bad. Now switch over for me to hepatitis E, which again is also fecal oral. Same, normal patients, you have a mild disease, it's usually acute, there's no chronic cases, again, just like Hep A. However, pregnant patients have very severe disease. Okay, not chronic, but you have to remember that pregnancy is an overall state of immune suppression. You got to remember that the mother is trying not to reject the fetus. So the hormones that she's making are immune suppressive, so she's in an overall state of immune suppression. And we'll talk about mortality rates in a minute, but for a pregnant patient, it is extremely high mortality rate. Now, hepatitis B and C. We're going to compare and contrast those a little bit before we really get into some of the diagnoses for hepatitis B. Hep B, you have acute or chronic. Acute infections with Hep B can be mild to severe, but most of the time you recover. But 5 to 10% of patients that acquire hepatitis B virus will develop a chronic infection. Now that's different than for Hep C, where the acute virus, the acute infection, is typically subclinical, so extremely mild. You may not even know that you're infected with hepatitis C until you go for routine blood work and they're like, whoa, what's going on here? 80% of those infected with Hep C become chronic. So hepatitis C has more of a tendency to become chronic. The other thing that's really important about that information is that because the acute infection with hepatitis C is subclinical, what are people going to do? They're not going to know they're sick, and it's going to spread. Okay? Now, as far as infants are concerned, infants that are born to mothers with hepatitis B, 90% will develop chronic infections. Okay, 90%. So that's a really high number. Now, I also want you to be aware that hepatitis B and C can cause primary hepatocellular carcinoma. So both of these viruses are responsible for causing liver cancer. Now, the exact mechanism is still a little shaky, but it's probably due to the continuous damage and repair of the liver that really sets off this transformation into primary hepatocellular carcinoma. So both B and C associated with cancer. Remember what we said, if you have a pathogen associated with cancer, it makes it a little bit more high yield. So you definitely don't want to forget they're associated with cancer. They can also cause cirrhosis, both Hep B and C. Now look at hepatitis D. Again, we said it was a defective virus, gets into a co-infection, the same cell with hepatitis B. Then you have a very, what we call, fulminant infection with hepatitis. You get cirrhosis, and it has an extremely high mortality rate with a co-infection with hepatitis D. Now, one of the facts I'm going to give you is that what hepatitis D is looking for from hepatitis B is actually the surface antigen, okay? So what's defective in hepatitis D that hepatitis B is giving to D to make it a fully functional virus is the surface antigen. All right, last for the tables We're just going to look at some of the mortality rates here. Typically, hepatitis A has a low mortality rate. Hepatitis E has a fairly low mortality rate, except for in pregnant patients. It's about 20%. All right. So, if they're mentioning in the vignette, okay, if they say that, someone presents with the symptoms of fever, jaundice, anorexia, malaise, they're pregnant, they'll give you, that they're 30 weeks pregnant or something, and they actually died from that hepatitis, they're then going to ask you either what type of virus that was, or sometimes they like to ask you what viral family it came from. So what you need to remember is as far as clinical relevance here, is you have to remember the virus, and you have to know the virus family for step 1 of the USMLE. So we're going to focus on that too as we move along. You can see the mortality rate for Hep B and C is really not extremely high, unless with hepatitis B you get that co-infection with hepatitis D. Then you have a very high mortality rate. Diagnosis for most of the hepatitis is simply serology. They're going to be looking for antibodies specific to the virus. And it is only really complicated with hepatitis B. So we're going to spend a little bit of time looking at the serology and diagnosis of hepatitis B. Now, determining whether a patient is acutely infected, chronically infective, chronic active infected, fulminant infected, etc., is really high yield for step 1 of the USMLE. They love to ask questions where you have a vignette and you have a little bit of data and you have to put 2 pieces of information together to actually get to the right answer. So this stuff is really clinically relevant. You're going to be using this a lot probably in practice as well, so it's a good time to get a good understanding of how this works. Now, first we're going to look at some of the terminology and some of the markers. The hepatitis B surface antigen is made in huge quantities during infection with hepatitis B. All right? The virus makes so much surface antigen that you can actually get immune complex disease from the surface antigen and antibodies binding to the surface antigen. So it makes a ton of this. So hepatitis surface antigen is found, you can find it during acute disease, but here's the big point that you're going to have to look for. Your main determinant of whether or not somebody has a chronic infection is going to be whether they have hepatitis B surface antigen past 6 months of the infection. That's the single most important marker that you're going to need to determine whether someone is chronically infected with hepatitis B. Now, the surface antibody, which is the antibody made to the surface antigen, provides immunity to hepatitis B. Now, when we vaccinate you for hepatitis B, we vaccinate you with the surface antigen. Again, it's the immunodominant molecule on the virus. It makes a ton of it. And what we're hoping happens is that you generate a good antibody response. So you have lots of antibody to the surface antigen, and that will render you immune to hepatitis B infection. So we have the surface antigen past 6 months, chronic infection. Surface antibody provides immunity. And we're going to look at some other markers here. The core antigen is a protein found inside of the virus. Doesn't really tell you a lot of information. Sometimes, though, they'll put it in the panel that they're going to give you. It really doesn't tell you much information, though. So whether it's, positive or negative, generally in an acute infection, it's going to be positive. In a chronic infection, it's going to be positive. So again, it doesn't help you differentiate much. But antibodies to the core antigen are essential in determining recent infections. So, during infection with hepatitis B, antibodies to the core antigen are the very first ones to appear. So this is going to be important in screening people for hepatitis B infections, especially acute infections. Now, sometimes in some of the panels that you're going to see on the boards, they may just say core antibody positive, all right? But sometimes they may actually give you a little bit more detail, and they might say core antibody IgM positive, IgG negative. Right there is your best indication that you have a recent infection. If you're finding IgM and you can't yet find IgG to the core antigen, that's your best indication that you have a recent infection. So now we'll look at the last set of determinants. The E antigen and antibodies to E are going to help you really with one major differentiation. The surface antigen, remember we said past 6 months, means that you have a chronic infection. How will you differentiate between chronic and chronic active? You're going to do that with the E antigen and the E antibody. The E antigen is simply another protein within the core of the virus, but it correlates with infectivity and viral production. So, if you have hepatitis B surface antigen past 6 months, and you're making significant E antigen, we're going to say you are chronic active hepatitis. Now, what happens with a lot of people is they'll go from chronic active basically to chronic. And that transition occurs when we can no longer really detect the E antigen, okay, in the blood, and now we're starting to see excess antibodies to the E antigen. When you start seeing an excess of E antibodies in the blood, that lowers the risk of transmission. So that's what you're going to use to determine if somebody is now simply chronically infected with hepatitis B instead of chronic active. All right? Those are all very important, clinically relevant. You know you're going to see them on step 1. So we really want you to hammer these down and know these backwards and forwards. So we're going to look at a couple of different more examples for the markers and how they can be used and what you're going to look for. Now, the delta agent is hepatitis D. If you're positive for hepatitis D, more than likely in the vignette they're going to have mentioned that the patient is severely ill and most likely is probably not going to make it. Okay? Now, the window period. Window period is important. That's what happens when we get to this spot where the amount of surface antigen equals the amount of surface antibody, and we can no longer detect either one in the blood. Okay? In the case of hepatitis B infection, that's called the window period. So what happened was we were just looking for surface antigen and antibodies to the surface antigen. We would get somebody and we would actually have tested them during their window period where we couldn't detect either one of those markers. And we're like, oh, you're fine, you're fine. They would go back, they would still not really feel great. So what happened was we misdiagnosed a lot of people because we were testing them in that window period. That's why the additional markers are so important, and that's when this really got complicated. Now we're going to look at those markers that we just talked about in graphic form and differentiate between acute hepatitis versus chronic hepatitis. So if you look at the background white line that you see, those are the liver enzymes, the spike in the liver enzymes. That's when you're really going to be getting the symptoms of jaundice, fever, maybe night sweats, and anorexia. The first thing I really want to show you, in acute hepatitis, you are going to have surface antigen and E antigen. But again, the first antibody, if you follow the black line, the first antibody to show up is antibody to the core antigen. So that's going to be important in screening recent infections. Now, the next thing I want you to look at is there is The window period, when again, approximately the same amount of surface antigen you have as surface antibody, so you've hit this zone of equivalence, or what we call here the window period. At this point in this window, you cannot detect surface antibody or surface antigen. Again, if you look, you can detect antibodies to the core. You can detect antibodies to E in the case of acute hepatitis. And eventually, when we start getting the antibody made in excess, we're going to be finding antibodies to hepatitis B surface antigen. Okay? So in acute hepatitis, the virus is going to be replicating, so you will find evidence of that by looking for the viral antigens. All right? The first antibody you're going to find is antibody to the core antigen. Again, they can kind of mix it up and give you IgG versus IgM. IgM, remember, means that it is a recent infection. Now, antibodies to surface antigen, when we start to detect this, we know that the patient is really probably in recovery mode. All right? Once you start really detecting that surface antibody, remember, that provides immunity to the virus. So we've recovered and we're starting to convalesce. We're getting better. All right? And that should now protect us for the rest of our lives from infection with hepatitis B. Now, we're going to look at the difference that you'll see with a chronic infection for hepatitis B. Again, the background line you see are representative of the liver enzymes and the symptoms for hepatitis B. Remember, the single most important indicator for this is, do you have surface antigen past 6 months? So you go to 6 months, you look up, you have surface antigen, you have a chronic infection. Okay? Now, that's usually not all they want to know. They want to know, is the person simply chronic or are they chronic active? So look at time point 1 year. Look at time point 2 year. We have surface antigen and we have the expression of the E antigen. Both of those together are suggestive that you have chronic active hepatitis. That means the virus is actively replicating. You're still finding signs of that by way of the surface antigen and the E antigen. Okay? So at those time points, you're definitively going to answer chronic active. All right? Now, look a little bit later on. Let's look at 5 years down the road. Let's look 6 years down the road. When we're no longer able to detect the E antigen in the blood, and now we're able to detect antibodies to E. Then you would answer, if given that information, that the patient had chronic hepatitis. Okay? We're going to look at this again in a little bit more just to make sure you're comfortable with it, because again, the hepatitis viruses, especially hepatitis B serology, is extremely clinically relevant for the boards. All right. One thing I also want you to notice that is not on this graph is antibodies to the surface antigen. In chronic hepatitis B, we're unable to detect antibodies to the surface antigen. Okay? Now, we still have antibodies to the core antigen. We'll eventually be able to find antibodies to the E antigen, but those don't provide immunity. All right? We're simply using them as markers for determining what type of infection we have. All right? So again, chronic infection, what's the single most important thing you're going to look for? Surface antigen past 6 months. How are we going to differentiate chronic from chronic active? Has to do with the E antigen and the antibody to the E antigen. Okay? If you have surface antigen positive, E antigen positive, we're chronic active. You have surface antigen positive, E antigen negative, E antibody positive, you have chronic infection. So now the last thing we want to look at for serology, just to make sure you're going to smash any of the questions that you get regarding hepatitis B serology, is to look at the different types of infections, okay, and be able to see which markers are going to show up. So let's first look at acute infection. In acute infection, you're going to find surface antigen, probably, maybe not E antigen, okay? You're going to find antibodies to the core. So that's, remember, going to be the most important determinant in screening for recent infections. IgG antibodies, though, probably in a recent infection you're not going to be able to see. And then surface antibody you're not going to see until a little bit later on. All right? Now, the window period, the only marker we have in the window period is going to be the antibodies to the core, and it's going to be IgM. That's why that is so important as a marker. Now, what if you're given a scenario of you have a person who was stuck with a needle, okay, they were stuck with a needle from a known hepatitis B person, and you do the serology, and you look at the fact that they have none of the antigens, but they have IgG antibodies to the core antigen, and they have IgG antibodies to the surface antigen. In that case, you're going to say they probably had a prior infection, okay, with hepatitis B, but they are now immune. Now, where it's going to get a little bit tricky is that because they're now immune, all right, you don't want to just put down that they're immunized, because if they're immunized, they are not going to have antibodies to the core antigen. Remember, you're getting immunized with surface antigen, so you're going to make antibodies to the surface antigen, okay? So immunization, if you look down across at immunization, if someone's immunized, the only marker you're going to find is antibody to the surface antigen. Whereas if you do things the hard way, like I do, and you become immune to hepatitis B from getting an infection with hepatitis B, you're going to have antibodies to pretty much all of those determinants of the virus. Okay? Now look down at the last row. You'll see chronic infection. Chronic infection, remember, we're going to have surface antigen there past 6 months. If we have, additionally, if we have the E antigen, remember, we're chronic active. If we no longer have the E antigen and we just have the E antibody, we're now simply chronic. During chronic infection, you're going to find antibodies to the core, but the one thing, again, you're going to be unable to detect are antibodies to the surface antigen. Okay? So good luck on those questions. Once you go through this a few times, it's going to be just like knowing your ABCs. And you want to smash those questions because you're probably going to get more than one of those on step 1.